Assalamu alaikum. I am really excited to give you this brief introduction to blood transfusion blood bank, mainly in UK. So the main role for the blood bank is to provide blood and safe blood and blood product to patients. We call it save lives. Also, the blood bank play a different role: management of the antenatal patients and the transfusion dependent patients. The main products provided by the blood bank are black blood cells, fresh frozen plasma, platelets, cryoprecipitate, factor concentrates, and prophylactic anti-day or immunoglobulin anti-day. But before providing this product, blood bank carries out number of tests, include blood group, antibody screen, antibody identification if needed, Dairy-Combe tests, Kleihauer tests, compatibility tests, or cross-matching. These tests are performed either by automated instruments or by manual technique using gel cards or tube techniques. Like I mentioned earlier, the other role of the blood bank is to manage the antenatal patients, mainly the antenatal patient with alloantibody produced during the pregnancy and the rhesus negative antenatal patients. This for the lab to give guide to the gynecology team to whether give IUT in advance or for early C-section. These are done by carrying out few tests such as titration for the antibody detected with those with positive antibodies, doing the fetal genotyping for those rhesus negative patients, and also the Kleihauer test at sensitized event and at delivery. That's to ensure safe delivery of the baby and also ensure safe subsequent pregnancy. Also, blood bank manage patients that are transfusion dependent and patient with multiple antibodies or autoimmune hemolytic anemia. For example, red cell exchange for sickle cell patients that require special blood, hemoglobin S negative blood, or sometimes multiple antibodies. These multiple antibodies require complex techniques to identify them, running through series of panels to recognize them and identify them. But most importantly is that the blood bank is able to provide blood that's compatible with those multiple antibodies or even patients with rare blood group that is from the blood center or from the frozen blood bank. Not to forget, all these tests has to comply with the British Society Hematology guidelines and are inspected by the MHRA. These are the list of the main reference in blood bank. And I shall talk to you again soon. Thanks for listening.